20-year life expectancy gap from those who live east of 35 versus those who live west. That is still a reality that we have today, where your zip code is determining your health outcomes and your life outcomes.
I think that no single advocate or community organization can adequately address all of the public health inequities that we're facing as a community. And so by having the summit, we get together, we can share all of our diverse perspectives. And I think working together just allows us to be more well-rounded, see different gaps in those health inequities that we face as a community, and again, provides us that space to talk about those priority areas as a group.
Well, you know, the history in Austin, we've seen a lot of disparities. You know, there's a lot of folks making decisions for people that sometimes don't have a voice. And so partnering with community health partners, the people that are providing the services, the community health workers that are boots on the ground, the community itself. And so it's about sharing information, it's about sharing resources. And you know, that is one of the most important reasons to come together.
And if we're all connecting and speaking in one voice, we can make a tremendous impact.
Everyone in Austin, regardless of what your zip code is, regardless of what race or ethnicity or economic background you have, that you have the resources that you need to live a healthy life, you know, with dignity, and that's what we want.
I hope that community members that showed up today feel like their voices really were heard and feel like the health department and all of our community partners are actually listening, and that we're not just here for show, it's actually to listen to the community and make a difference.
This is my 5th round of doing community health needs assessments. So many of these social issues are systemic, and so they haven't changed in those 5 rounds. And I think that requires us to think differently, to think more systematically, and think about what needs to change at the system level to impact these very ingrained social issues.
How do we increase Austin's autonomy from state overrule?
I think the diversity of thought helps us have a better product. Government sometimes is clunky, and we don't do things as well. We're not as nimble as some of our nonprofit partners. So to have government be able to support convening and investment and policy change and match that with real-time, boots on the ground, data information, and the ability to act and be flexible is a great marriage.
I'm hoping that we are disruptive. I hope that we say the thing that everyone is thinking, and I hope that we don't shy away from the real issues.